Well, thank you. What I want to do today is showcase what I think is the American dream come true in Mr. Cromer's business enterprise here. He started this his business in his house with his wife. Correct. They had one truck. Now they have 85 employees. They service over 700 vending machines a day. They have 45 trucks out on the road, and it is an amazing success story for a man and a woman to start in the basement of their house to build this wonderful business. Mr. Cromer is in the middle of the Obamacare debate, and let me tell you why it really matters to him. He pays 75% of his employees' health care premiums. So for individuals and families that are insured through Mr. Cromer's business, the company pays 75%. That's about $10,000 a month, $120,000 a year to insure his employees. Under Obamacare, they estimate that his insurance costs will go up by $200,000 a year. So before Obamacare, he was paying 75% of every employee's premium, $120,000 a year to his business. After Obamacare, he's going to be paying $320,000 because Obamacare requires more coverage and it's more expensive. He's told me that he can no longer pay 75%. Why? Because last year his profit was about $200,000. So in effect, the increased cost from Obamacare of $200,000 for additional insurance coverage wiped out what he made last year for the whole business. So he's in a bind. He's going to have to do a couple things. Either reduce the number of employees, have the employees pay more for their part of the health care. Their deductibles and co-payments will go up because you've got to make a profit to stay in business. And I've been talking to his employees. One person had been here 17 years. Everyone else had been here over 20. Obviously, Mr. Cromer has a loyal following in terms of employees. I met the person who was his number 2 hire. So this is very much a family business where people feel part of Mr. Cromer's business. And he treats them like family. There's a feeling around here where people feel like they're working as a partner. They're just not the hired help. And this is Exhibit A of what Obamacare is going to do to small business people. The additional cost caused by Obamacare is going to wipe out every dollar in profit he made last year. And that means that his employees are going to get less in money. Their insurance costs are going to go up because he will no longer be able to pay 75% of the premiums as he does now, because the $200,000 additional cost is going to make that impossible. So with that, I'll let you hear from the man himself, and he can explain to you the dilemma his business faces.
Thank you, Senator Graham. What we are trying to do is grow our business, but we have the uncertainty of not knowing what Obamacare is going to cost our company. And this next year, we had plans on growing the company. Our insurance renews in June of each year, and in 2015, we had planned on expanding our business after we found out the cost of Obamacare, but now that's been put off because we fall into the category of the 50 to 100 employees. We have 85 employees. Now we have nearly 2 more years of uncertainty. So what we'll do is take and hold our money back, not hire any employees, hopefully not hire any more new employees, because that is an ongoing expense, and we don't know, once you give an employee a pay increase or promote someone up, you can't take that back away. So we're holding back. We find out what Obamacare is going to cost. So in essence, we really would like to know what it is going to cost us as soon as possible so that we can stay in business. Thank you, Senator.
Okay. Any questions?
I know that you, Senator, had signed up for the
Here's the lesson from Obamacare for me. Most people are going to pay more and get less coverage. In my case, that was dramatic. I was covered under the Federal Employees Insurance Plan in Washington. Under Obamacare, we could have enrolled into the D.C. exchange. I would have lost a federal employee health care plan that I was covered under. I could have gone into the Obamacare D.C. exchange, and the federal government would have paid 75% of my premium. Under that model, my premiums would have gone up about $100 a month. But most South Carolinians can't enroll into the D.C. exchange with a 75% contribution from the federal government. So I said, listen, I'm going to live my life like a 58-year-old short white guy from South Carolina and sign up into the exchanges like somebody from my state. Well, I live in Oconee County. My premiums have tripled. My deductible went from like $500 to $6,000. It's been thousands of dollars of additional costs for me, and I bought the bronze plan. My coverage went down dramatically and my costs went through the roof. And how can that be? Well, the reason it's costing me more is because a lot of people not covered are getting insurance, and I'm helping them pay for it. And so will you. That $200,000 additional cost to Mr. Cromer's business is collected to give subsidies to people and to cover people. The insurance system upside down to deal with the uninsured. We need not do that to help the uninsured. Why should I and others in my situation have to have a dramatic increase in our cost to deal with a small percentage of Americans who are uninsured? Why should this man lose all of his profits through additional insurance costs if this is good for the economy? The Obamacare plan was sold to us that you'll get more and you'll pay less. The additional costs will be like a cell phone. There'll be small additional costs and you'll get more coverage. Well, that's turned out to be a flat lie. People are losing their health care in the private sector. Thank God that he's not going to drop the health care. There'll come a day, if this doesn't stop, to where Mr. Cromer will say, I can't absorb $200,000 of additional cost. I'm going to have to drop coverage and let my employees go into the exchanges. He's decided not to do that yet, but if the cost of Obamacare keeps going up, there'll come a day where he'll have to drop insurance, and all the people that used to have insurance working for him will go into these exchanges. Let me tell you three things that are very important about Obamacare. If you make over $45,000 as an individual, you lose your federal government subsidy. You get some help from the federal government to pay your premium if you make $45,000. What if he offered a promotion, someone making $50,000? The person getting promoted would turn it down because they would lose their subsidy. Now, workers are not covered if they work 29 hours a week. People here work 40 hours a week.
Yes.
There may come a day where he'll say, I can't hire anybody new at 40 hours, so the next group of people he hires will be part-time workers because they won't be covered under Obamacare. Or he may have to go to some of his people and say, for me to keep you on, I'm going to have to reduce your hours. So those are two incentives that really stop economic growth. People are deterred from getting raises because they'll lose their subsidies. Employers are basically encouraged to reduce hours because a 29-hour employee is not covered by Obamacare. Numbers do matter. He's at 85?
85.
If he went to 101, it would be even more expensive. So you're not covered unless you have 50 employees. So if you're at 48 employees, you would be crazy to hire 3 people more because that puts you in a new category of cost. If you go over 99, that's a new category of cost. So he's right in the middle. He's deterred from having 101 employees. What's the most people you've ever had?
170.
All of the incentives of Obamacare are anti-growth, anti-worker, anti-employer, and this thing needs to be replaced. South Carolina needs to opt out if she can, President Obama needs to quit changing the law every 15 minutes, come back to the Congress and see if we can do better. Anything else?
Since you've come out of the opt-out of Obamacare, when we did the press conference last week or the week before it was, what kind of feedback have you gotten from voters as far as...
I met a lot of people on the street who say, can we opt out? They're excited about doing something. What Mr. Cromer doesn't yet know, because of the year delay, is exactly how much it's going to cost him to comply with Obamacare, because he's got a one-year reprieve. Well, people think that's a good thing. From his point of view, it's a terrible thing, because he can't make a good business decision. He knows right now it's about $200,000 a year. Well, he needs to be sure it's going to be $200,000 a year so he can reconfigure his business. But when people tell me that there's a chance to opt out of this and get their old coverage back, they're very excited. I'm hoping the House of Representatives will take up our legislation and have a vote on it. I can't make Harry Reid take the bill up, but the House could do this if they chose. But there's a lot of excitement out there in South Carolina about the idea I may be able to get my old insurance back and have a way to avoid the cost of Obamacare.
Do you feel confident that that will ever happen?
I feel confident that the more we attack the problem, the better results we'll get. People like Mr. Cromer are going through a lot of soul searching. How do you stay in business? Do I have to lay people off? How can I absorb that $200,000? Clearly, if it wipes out all his profits, he's not going to be able to do status quo. I would imagine he's going to tell his employees, I can't cover 75% anymore. That wipes out all we make. And they'll probably have to pay more. So I really do think that in 2014, as we get closer to the elections, Democrats who are in very contested seats are going to start turning to people like me and say, can we find a better way? At least I hope so. I've never seen a single piece of legislation hurt so many people in the name of doing good. I've never seen a single piece of legislation that was sold so unfairly. We were basically hoodwinked. President Obama sold this bill in a way that was not accurate. He promised if you want your coverage, you can keep it. You like your doctor, you can keep it. The cost of the bill is gone up 3 times as to what they anticipated the effect on the economy. CBO did a report not long ago saying the actual cost is 3 times greater than when the bill was sold. And I can tell you this, on the day we voted for Obamacare in 2009, if people had known then what we know now, this bill would never pass, and the way it was sold to us was a big fat lie. Thank you.